What I want to tell you about today is basically our journey from starting a 3D printing lab and our struggles, our successes, and hopefully you can take something away from this that will make your experience a little bit easier. So, I'm not going to go hugely into 3D printing. This is a 3D printing conference. Most of you know what it is, but just really quickly. It's an additive process. You build on things layer by layer, you make the object. This is in contrast to other methods such as molding or subtractive manufacturing, where you take a block of wood and you whittle it away. So why are we doing this? To me, I was so happy and so grateful that Roger was able to come today and talk to us, because that is at the very basis and the very heart of what we're doing. We're doing this to improve the patient experience. We're doing this to take that next step in personalized medicine for our patients. So this is just Jason and I in our recent presentation at the International Forum of Quality and Safety. So Liz and a few other people have already touched on these topics today. And we heard from Roger himself about how he was much more motivated to get his aneurysm repaired, because he then understood what exactly it was and how horrified he was by how it looked like an alien. So it improves patient understanding, improves their satisfaction, and obviously we love it because we use it to plan. Some caveats, which we have also brought up today: it is a young field. It is mostly small reports. There are no randomized controlled trials, as has come up earlier today. We did survey the clinical trials registered. None are complete yet. No large-scale trials anyway. Watch the space. It is coming. But I know we tend to get very excited about this technology. Sometimes we do have to be objective. I know we're all proponents of the field. So this is what I do. A lot of the time people are surprised to hear that we have a lab, or if they do, a lot of the time what people think we have is something like this, which is what a lot of our colleagues today have presented. My friends just think I'm a massive nerd, so that's just me. It's what my patients think I do, my parents, and society, and this is what our lab actually looks like. So it's a little corner in what used to be the registrar's office out of the Department of Vascular Surgery. As Eric's already brought up, we have a website. This is how we communicate with people. We love hearing from people. We have a Twitter. Come say hi. 3D Med Lab, it's more a collection of interested individuals working towards a common goal of bettering patient outcomes. I won't steal Nathan Lawrenchuk's thunder for tomorrow, but he's been using it in pre-surgical planning for his partial nephrectomies for his kidney cancer patients. We've also been using it in the field of orthopedic surgery. What I do want to highlight, though, is that last case. So this is a mouse anesthesia model, which was designed by Mike, who's over there and is cacking himself right now. So that took him, not even an hour to design. Cost 50 cents in materials, would you say? And the conventional model, the conventional one that you would buy if you wanted to put a mouse to sleep and then do all kinds of operations or implant tumors in its back or whatever, that would cost easily 150 times that. So yes, it is about surgical planning and all the conventional things we've been talking about, but it's also about fostering that culture and that community of innovation. It's also about democratizing research, not just 3D printing research. Basic science research as well stands to benefit. So you don't have to 3D print everything. This is something we learned early on. It's a cool technology, but you can use it with other things as well. So research platforms and us collaborated to make this wound care model for mostly yucky, deep diabetic foot patients and plastics patients. And it just teaches junior nursing staff how to properly pack a wound. So we actually printed the negative, cast it around Lego, cheap as chips, cast it in silicone, put chili sauce in it, and there you go, you've got a model for about $5. This is another case just showing the fact you don't necessarily have to 3D print. So with the urology team at the Austin, what we did is we made models and we integrated that into the graphical user interface of the Da Vinci robots. So when the surgeon was operating, the primary surgeon could see the model and use that as a reference point, especially for very complex procedures. The model was never printed then. Still great for the patient. And this is from the literature. I was marking another one of our students, Gordon's excellent lit review the other day, and from that, I actually came across this, this example from the ENT literature. So they didn't 3D print everything. They 3D printed the parts they needed for the tracheoesophageal puncture model, and then they put squid around it. So I thought we were pretty cool with our chili sauce, but this is taking it a step further. Maybe we should be friends. Chili sauce and squid do go really nicely together. So I guess this is the part of the talk where I tell you how we started. It's been up and down, and it's been a joy, but sometimes it can be really hard work. So about 2014, a 3D Med interest group was formed, as Jason mentioned, down at the pub down the road. We were very lucky to secure some funding from ACMAV, from which we started our lab. So in a little corner in the vascular registrar's office, we purchased a couple of MakerBots, started with open source software, such as 3D Slicer, and open source AutoCAD software like Tinkercad and MeshMaker. We used filament that you could either get open source or proprietary, spanning from $20 to $80 a roll. And that little Bulbasaur is one of the first things that I printed. And the reason it's up there is just as a benchmark for how much all these different technologies I'm going to introduce you is going to cost. So that little Bulbasaur, you can kind of get the scale of that based on my hand. That costs 30 cents. We'll compare that with everything else that's coming. So this is our lab. It's not quite what we've seen today, but it's ours, and it's special to us. This is how we started, and we still have $0 in terms of staff FTE. This lab is completely run on the goodwill of volunteers and people wanting to make a difference in patients' lives. Jason donated a computer, still the one we use, and we are using some proprietary software now, at least trying it out. And Ian, unfortunately, can't be here today, but Ian started our sister lab at Box Hill. I just put the slide up just to highlight the fact that the FlashForge Creator Pro is a good third of the price of the MakerBots, and that's basically a dupe of the MakerBot. And within about 2 years, this dupe was made, and it functions just as well. Obviously, using the same RepRap design, the filaments are the same, the cost is about the same. And then, next, I'm only showing you the good bits, by the way. We've had a fair few fail grants in between, as I'm sure you all have had as well. Next, we were able to secure funding from our own institution, so the Austin Medical Research Foundation. Formally started calling ourselves 3D Med Lab, got a logo, was really excited. And then from the university, this is what we've been trying to get at all day. We're bridging that gap between the university and the hospitals, between engineers and clinicians. Just from a conversation we had in the engineering workshop, we ended up inheriting our first and only PolyJet printer. So just for comparison, this Bulbasaur is now a little bit more expensive at $3. So material is about 10 times the cost of previously. It's a little bit more expensive to run, but obviously depending what you're using it for, different printers suit different needs. And then we got the Harold and Cora Brennan Benevolent Trust funding, which we are obviously very grateful for. And NEMICS actually funded us outside of their grant process, because even though we didn't quite necessarily meet the requirements, the consumers were just so excited by the concept and by the pretty photos we put in our grant application that we actually got funded outside of that. So we're very grateful to them as well. And then from that, we bought our Form 2 and the accessories that go with it. It's a printer which you can actually have a look at outside if you want. ThingLab very kindly brought some Form 2s. Same technology that Tim was talking about earlier, or similar. That was DLP, this is the SLA printer. And then finally, we got the Ultramaker most recently. So this is really to replace the MakerBots, which were getting a little bit long in the tooth and probably not as reliable as they should have been. With this technology, this costs twice as much as a MakerBot. I reckon it's at least 5 times better. And you do have to replace this technology, and as the technology moves on, it has become more reliable. Their proprietary filament's a little bit expensive, so little Bulbasaur there will cost about 50 cents. And as I said before, thank you to Materialize for sponsoring this conference. We are starting to partner with them, and we're starting to explore this proprietary software. And this is just me when I finish my work, and I've run out of theatre, and I'm super excited, and I've just given my new printer a huge hug. And I think our events manager, Julia, took this picture to humiliate me, but I have no shame, so it's up there for everyone. So I was kind of alluding to this before. These are mostly desktop printers. It isn't always necessarily roses. You can have print failures. These machines are not these massive $1 million commercial machines, but they suit our purposes. Obviously, I'm not saying if someone wants to give me a J750, I'm not going to say no. But yes, fit for purpose. I guess the point of what I'm trying to get to with this talk is you can actually start a lab for less than you think. And then most recently, as part of Peter Lee's very successful ARC funding, we're very happy to be part of that. And as Hussein alluded to earlier, really excited to start seeing this cross-pollination of ideas and having engineering students coming and spending time with us. So this is an issue people have touched on as well. We don't receive any direct funding from the hospital for our work. Fostering that culture of people, it's taken us probably 4 years for people to be like, oh yeah, there's a lab, oh go see Jason, go see Jazz. If you need this printer, just go have a chat to them. This is something that potentially they can help you with. It's taken time to build that momentum. And obviously, as it is, for example, in the Mayo Clinic, the ideal workflow would involve the models being made in radiology and then brought to, say, our lab for printing, or maybe even the printers being located in the Department of Radiology, but that's actually rarely the case. And obviously having to justify it without these large RCTs, which administrators want to see. Sometimes it does feel a lot like this. And as Eric touched on before, collaboration and community. This is what we're all about. Thank you to everyone who's come today. Thank you for being a part of a community. So I don't know how many of you know Andy or Matt, so they're pretty big in this space as well, especially in the airway simulation and emergency simulation space. So just for comparison, Ian made that model from our lab, another couple. There are many ways to skin a cat, but what is beautiful is that sense of collaboration and people putting things online for free for other people to modify and use as they wish. Eric's touched on social media, so I won't keep going when he can do it so much more eloquently, and has like 10 times more followers than me, easily, maybe 20 times more followers than me. But this is how we communicate with our community, and this is how we reach new people, and this is how we help new people. So this is not as impressive as Jen's map, but this is what I like to call the hub and spoke model. I mean, it is an extension of imaging, all this 3D printing what we're doing. So we've got Jason, we've got Raf. We're going to be a bit cheeky and confess I cropped the wine glass out of Raf's hand in that picture. Obviously, Liz, Tracy, Ian, who can't be here today, Eric has been wonderful promoting things on social media for us, and Julia, our events manager, Jan, who I actually met through social media. So we tweeted at each other, which resulted in him flying from Poland to do a summer internship with us. And now he's gone back to Poland, he's doing a PhD in 3D printing. Andrew, who was the student who came after me and fixed the printers after I broke them. And we now also have Michael and Gordon, and it's been an absolute pleasure. And the students are the way of our future, and we cannot do it without them. So, in conclusion, I just wanted that we've had some really highbrow research being done, but I also want to point out that you can do it at the grassroots. You can start a 3D printing lab for a lot less than you think. Coming here, starting this conversation, going out on social media, that is the first step. We need to talk to each other, because at the end of the day, what we want is to put our patients first and to make our lives better for our patients, and we all do that in different ways. So why not do it together? And obviously, we do need more large-scale studies, but that will come with time, especially if we all keep working on it together. So thank you to everyone. Thank you for coming.